Hi, I'm Travis Burns. I'm an orthopedic surgeon with Christus Santa Rosa Outpatient Sports Medicine in Ortho San Antonio. I have subspecialty training in treating sports injuries and have an expertise in arthroscopic hip surgery. Patients of all age and activity levels develop hip pain. I will discuss a few of the common causes of hip pain and treatments for these conditions. We will discuss hip osteoarthritis, hip labral tears and femoral acetabular impingement, trochanteric bursitis, and tendinopathies around the hip. Osteoarthritis is the breakdown of this cartilage that can lead to joint stiffness, swelling, and pain. Hip osteoarthritis specifically refers to the breakdown of cartilage on the femoral head and acetabulum. As the cartilage breaks down, the joint becomes irregular, can form bone spurs that limit motion and cause pain. Hip osteoarthritis is commonly aching pain that is worse at the end of the day, is felt in the groin, and is associated with a loss of hip motion. This is initially treated with non-steroidal anti-inflammatories and possibly steroid injections. Next, we'll talk about hip labral tears and femoral acetabular impingement. Labral tears around the hip are commonly associated with a condition called FAI, which stands for femoral acetabular impingement. This long word simply refers to bony contact between the femur and the acetabulum. This can occur if the ball of the joint has a bump on it rather than being perfectly round. This is referred to as a cam deformity. You can also get this abnormal contact if the socket side of the joint is too deep or is oriented in the wrong direction. Pain is commonly in the groin with the FAI, and authors have described a C sign as a place of pain where patients make a C shape with their hand and put it on their hip to describe that location of pain. The impingement happens with the hip flexed, so the pain is typically worse in deep-seated positions and is worse with attempts to take your hip across the midline, as well as with internal rotation of your leg. Treatment for FAI and labral tears is an initial trial of anti-inflammatories and physical therapy. A hip steroid injection can be used to verify that the intra-articular space is the cause of your symptoms. Surgical management of FAI can be performed with an arthroscope or minimally invasive surgery with small 1 cm incisions to shave down that extra bone, repair the torn labrum, and prevent that bony contact. Moving on to trochanteric bursitis. Trochanteric bursitis is noted by marked pain on the outside of your hip over that bony prominence we talked about, the greater trochanter. This is usually worse with walking and standing and has tenderness to the touch over that bony prominence. This occurs as the iliotibial band rubs over that prominence, causing inflammation of the bursal tissue between those two surfaces. This is treated initially with anti-inflammatories, rest, and stretching of the iliotibial band. It also commonly responds to a steroid injection into that bursal tissue to decrease pain and inflammation. An arthroscopic procedure can be performed to shave out that inflamed tissue if the pain persists, but is usually not necessary. Moving on to tendinopathies around the hip. As we previously discussed, there are numerous tendons and muscles around the hip that can develop degenerative signal called tendinopathy that is marked by a color change on MRI. First, the iliopsoas is a tendon in the front of the hip that can become inflamed. It is associated with anterior hip pain that is tender to the touch and worse with attempting to lift your leg straight up while laying down. This can usually be resolved with steroid injections, but arthroscopic tendon lengthening can be performed in the right situations. Next, the gluteus medius. This is associated with pain on the outside of the hip that is worse with walking or running and worse with lifting your leg out towards your side. The hamstring tendons in the back of the joint can be associated with partial thickness or full thickness tears that typically occur with rapid flexion movements at the hip, such as falls water skiing or with hard contractions during sprinting. These injuries can be treated with therapy or surgically repaired depending on the severity of the tear. Moving on to lumbar radiculopathy. Finally, when evaluating hip pain, a cause of pain from the low back should be considered. Nerve roots exit your lumbar spine and travel down your legs. As a result, impingement on one of these nerves can lead to hip pain and should be evaluated as a possible cause of your symptoms. It is associated with burning pain radiating down your leg and can be associated with muscle weakness in specific muscle groups down your leg. If you are suffering from hip pain, you don't have to just live with it. There have been significant advancements in operative and non-operative treatments, and it would be worth seeing a hip specialist to evaluate the cause of your pain. Please visit my website for additional information on hip conditions and to schedule an appointment.